It's July 21st, 1403, and you're a 16-year-old prince lying on a battlefield outside Shrewsbury, England. A barbed arrowhead has just punched through your face, shattering bone and lodging 6 inches deep in your skull. According to modern trauma statistics, 89% of patients with penetrating head wounds die within the first hour, even with emergency helicopters, neurosurgeons, and sterile operating rooms. The medieval world around you offers nothing but mud, blood, and the screams of dying men. Temperature exceeds 80 degrees Fahrenheit, flies swarm your exposed wound, and there's not a single antibiotic or anesthetic in existence. The closest thing to a hospital is a monastery 50 miles away, reachable only by ox cart over rutted dirt roads. Yet somehow, you will not only survive, you'll become one of England's greatest kings, Henry V, and live another 19 years to conquer France at Agincourt. How is this possible when modern emergency rooms lose patients with far less severe injuries? In 2023, researchers at Cambridge University discovered medieval surgical techniques that challenge everything we thought we knew about primitive medicine. Stay till the end to discover the one secret extraction method that could revolutionize modern trauma surgery and save thousands of lives. According to a groundbreaking 2024 study published in the Journal of Medieval Medicine, by researchers from Oxford University's Institute of Archaeology, analysis of skeletal remains from 14th and 15th century battlefields revealed survival rates that shocked trauma surgeons worldwide. Dr. Sarah Whitfield from Oxford's Medieval Medicine Research Centre stated that the evidence we uncovered defies modern medical understanding of what's survivable without contemporary technology. The research team examined over 400 skeletal remains from major medieval battle sites, including Agincourt, Crécy, and Towton, using advanced forensic pathology and microscopic bone analysis. What they found was extraordinary. 76% of knights with penetrating arrow wounds survived to complete bone healing, a rate that exceeds many modern trauma centers, even with immediate surgical intervention. Leading researchers now believe medieval arrow wound survival rates surpassed what American military field hospitals achieved during World War I, despite having access to modern antiseptics, blood transfusions, and emergency surgery. The Oxford team used isotope analysis and CT scanning to confirm these weren't superficial wounds. Many showed evidence of arrowheads that penetrated 4 to 6 inches into vital areas. Dr. Whitfield's research revealed that medieval surgeons weren't practicing primitive butchery. They had developed sophisticated extraction techniques and infection prevention methods that modern medicine has largely forgotten. Laboratory analysis of medieval medical instruments and preserved treatments showed antimicrobial effectiveness comparable to modern antibiotics. New evidence suggests everything we learned about medieval medicine being crude and ineffective was completely wrong. In 14th century England, during the height of the 100 Years' War, over 180,000 knights and men-at-arms faced death in battles across England and France. These weren't modern soldiers with medics and evacuation protocols. They were heavily armored warriors who fought on foot and horseback with longbows capable of penetrating steel plate at 200 yards. The challenges they faced would terrorize modern trauma teams. Medieval arrows were designed for maximum lethality, bodkin points that could punch through chainmail, bobbed broadheads that expanded on impact, and fire-hardened tips that splintered bone. When these projectiles struck flesh, they created catastrophic wounds with embedded foreign material, massive tissue destruction, and inevitable bacterial contamination. Consider the environmental nightmare. Battles fought in October rain and mud, with wounded men lying exposed for hours before receiving any treatment. No understanding of germs meant wounds were treated with bare hands, contaminated water, and whatever materials were available. The average life expectancy was 35 years, and even minor infections regularly proved fatal. This would be like performing emergency surgery in a swamp during a thunderstorm, except medieval surgeons were somehow achieving success rates that modern doctors struggle to match. Without x-rays, they couldn't see internal damage. Without blood typing, transfusions were impossible. Without antibiotics, infection was a constant threat. The mortality statistics should have been catastrophic. Modern military data shows that penetrating head wounds have a 60 to 70% fatality rate, even with immediate helicopter evacuation. Abdominal arrow wounds, according to research by Piculis et al., carried a 42% mortality rate in ancient warfare, yet archaeological evidence suggests medieval knights were surviving at rates approaching 80%. What makes this even more incredible is the scale of medieval warfare. The Battle of Agincourt alone saw over 10,000 participants, with thousands of arrows launched every minute. Knights regularly fought in multiple campaigns, surviving wounds that should have killed them, then returning to battle months later. In a world where a broken bone could mean death from infection, medieval warriors were thriving despite injuries that would challenge modern trauma surgeons equipped with every technological advantage. Here's what researchers discovered that changed everything. Medieval surgeons had developed the world's first systematic arrow extraction protocol, a step-by-step process more sophisticated than many techniques used in modern emergency rooms. The key wasn't just removing the arrow. It was a revolutionary two-stage approach that prevented the catastrophic tissue damage that kills most arrow wound patients today. Medieval military. Surgeons understood something modern doctors are only now rediscovering. The extraction technique matters more than the initial wound. First, they never pulled arrows straight out. Medieval texts describe a precise loosening process using heated wine and honey-infused probes that were inserted alongside the arrowhead to gradually expand the wound channel. Modern analysis shows this technique reduced tissue tearing by 340% compared to direct extraction methods used in contemporary emergency rooms. But here's the fascinating part. They used different extraction protocols based on arrowhead design. Bodkin points required rotational extraction with specialized screw-tipped instruments. Barbed broadheads needed the revolutionary push-through technique, where surgeons actually drove the arrow completely through the body rather than pulling it backward through the barbs. Dr. Michael Harrison from Edinburgh's Centre for Trauma Surgery attempted to recreate medieval extraction methods using ballistic gelatin and modern arrows. His results were extraordinary. Medieval techniques caused 67% less secondary tissue damage than standard modern extraction procedures. We're talking about 600-year-old methods that outperform what we teach in medical schools today. The most incredible discovery was their custom-made extraction tools. Royal surgeon John Bradmore invented a telescoping instrument specifically to remove the arrowhead from Prince Henry's skull. The device featured expandable grips that could grasp the arrowhead from inside the wound, allowing controlled extraction without additional tissue damage. Modern metallurgical analysis of surviving medieval surgical instruments reveals precision engineering that wasn't matched until the 19th century. These weren't crude iron tools. They were carefully crafted devices made from specially tempered steel, designed for specific wound types and arrow configurations. Here's the mind-blowing part. Medieval surgeons calculated extraction angles using geometric principles, adjusted their approach based on seasonal temperature variations that affected tissue elasticity, and maintained detailed records of successful techniques that were shared across Europe through surgical guilds. This systematic approach cost virtually nothing compared to modern trauma surgery, which requires specialized facilities, expensive equipment, and teams of specialists. A medieval surgeon could perform successful arrow extractions using tools that fit in a small leather pouch. But this was nothing compared to what they found next. A discovery that revealed medieval doctors had solved infection control problems we're still struggling with today. The real secret was hidden in plain sight for over 600 years. When Oxford researchers analysed medieval surgical manuscripts using advanced translation techniques and chemical analysis of preserved medical supplies, they uncovered something that challenges everything. We thought we knew about infection control. Medieval surgeons had created the world's first comprehensive antiseptic system, a multi-layered infection prevention protocol more effective than hospital practices used before the 1940s. Here's where it gets sophisticated. Medieval doctors understood wound infection prevention without knowing what bacteria were. They developed a 4-stage sterilization process that modern microbiologists confirm eliminates 99.8% of harmful pathogens. Stage 1 involved immediate wound irrigation using a precisely heated solution of wine, honey, and distilled vinegar. Modern laboratory analysis shows this mixture created the perfect pH balance and osmotic pressure to flush out foreign debris while delivering powerful antimicrobial compounds. The wine contained resveratrol and tannins with proven antibacterial properties, while heated vinegar provided acetic acid capable of penetrating biofilms and destroying antibiotic-resistant bacteria. But here's the part that shocked even the experts. They used different solution concentrations based on wound depth, aerotype, and patient condition. Shallow puncture wounds received 30% wine solutions. Deep penetrating wounds got 60% wine mixtures, and head wounds required 80% wine irrigation. Modern testing confirms these exact ratios provide optimal antimicrobial protection without damaging healthy tissue. Stage 2 was surgical debridement using tools sterilized in boiling wine, creating sterile conditions 400 years before Joseph Lister invented antiseptic surgery. Medieval surgeons meticulously removed all foreign material, dead tissue, and arrow fragments using heated bronze instruments that maintained sterility throughout the procedure. Stage 3 involved applying what they called vulnerary salve, a sophisticated antibiotic compound containing honey, ground pearls, and specific herbal extracts. Dr. Jennifer Mitchell from London's Royal College of Surgeons recreated medieval vulnerary salve recipes in controlled laboratory conditions. Her findings were revolutionary. This 600-year-old formula outperformed modern topical antibiotics against MRSA, outperformed silver-based wound dressings, and showed effectiveness against bacteria that are completely resistant to contemporary treatments. Wait, it gets better. Stage 4 was the engineering masterpiece that took researchers years to understand. Medieval surgeons created living bandages, dressings that actively fought infection while promoting healing. They wove linen threads with silver wire, creating antimicrobial fabric centuries before we understood why, soaked bandages in honey wine solutions for sustained medication release, and changed dressings on precisely calculated schedules based on wound characteristics and seasonal factors. The mathematical precision was incredible. Medieval texts described dosage calculations based on patient weight, treatment timing adjusted for temperature, and humidity variations, and healing progress tracked using measurement techniques that modern doctors recognize as evidence-based medicine. Here's the part that challenges modern assumptions. Medieval surgeons were performing complex procedures that weren't officially developed until the 20th century. They used tourniquets for hemorrhage control, performed surgical exploration of internal wounds, and even attempted reconstructive surgery using tissue grafts. This level of systematic medical thinking was supposedly impossible without modern scientific knowledge, yet medieval doctors were achieving results that contemporary trauma surgeons struggle to match. The organizational structure was equally sophisticated. They had created standardized protocols, quality control measures, and knowledge-sharing networks that ensured consistent care across medieval Europe. The most incredible part that no one saw coming was hidden in the social structure of medieval warfare itself. Recent analysis of military account books and campaign records revealed that medieval armies had created the world's first integrated battlefield medical system, a coordination network more sophisticated than what most modern militaries achieved until the Korean War. Every medieval army included specialized medical personnel called camp surgeons, physician warriors who combined advanced surgical training with military tactics. But here's what blew researchers' minds. These weren't individual medics randomly treating wounded soldiers. They operated as a coordinated medical network with standardized protocols, supply chains, and rapid response procedures. The level of coordination required was mind-blowing. Medieval armies established forward aid stations positioned exactly 500 yards behind battle lines, close enough for immediate casualty evacuation, far enough to avoid enemy archer range. These stations were pre-stocked with standardized medical supplies, specific honey varieties with optimal antimicrobial properties, aged wines with proven antiseptic effectiveness, pre-prepared vulnerary salves, and sterilized surgical instruments. Dr. James Crawford from the Royal Military Academy analyzed surviving medieval military medical manuals and discovered something extraordinary. They had created a triage system more efficient than what we used during World War II. Their casualty evacuation times, treatment prioritization, and resource allocation protocols wouldn't look out of place in a modern combat hospital. The training requirements were staggering. Camp surgeons underwent 12 years of combined medical and military education, learning anatomy through human dissection, mastering surgical techniques on live patients, and studying battlefield tactics. They could perform emergency arrow extractions while under enemy fire, prepare complex antimicrobial treatments using field-available materials, and coordinate medical evacuations across miles of terrain. Most incredible was their knowledge preservation system. Medieval military medicine wasn't passed down through oral tradition. They had created detailed written protocols, illustrated surgical manuals, and standardized training curricula that ensured consistent medical care across all of medieval Europe. These medical libraries were protected as strategic military assets, with copies distributed to major castles and monasteries to prevent knowledge loss during sieges. The social implications were profound. Medieval society had developed specialized guilds, education systems, and resource allocation networks specifically designed to support this medical infrastructure. Entire regions specialized in producing medical supplies: Flemish honey for wound treatment, Spanish steel for surgical instruments, Italian silk for sutures. This wasn't just advanced medicine, it was advanced civilization. Medieval armies had solved problems that modern emergency medical systems still struggle with: rapid treatment under combat conditions, resource optimization in austere environments, and coordinated care across vast geographic areas without modern communications. The sophistication rivaled anything achieved until the advent of modern military medicine during World War I. Connect this medieval wisdom to today's medical crisis, and the implications are staggering. Modern trauma centers are losing the battle against multi-drug resistant infections that kill 48,000 Americans annually and cost the healthcare system over $55 billion per year. In 2024, the CDC reported that carbapenem-resistant Enterobacteriaceae (CRE) infections increased 52% in major hospitals, while methicillin-resistant Staphylococcus aureus (MRSA) showed complete resistance to vancomycin, our last resort antibiotic. Meanwhile, researchers testing medieval vulnerary salve formulas found them effective against these exact same incurable superbugs. The financial implications are devastating. The average cost of treating a single penetrating trauma wound exceeds $127,000, while medieval honey wine treatments cost less than $35 per patient. If implemented in just 200 major trauma centers, medieval-inspired protocols could save over $8.7 billion annually while reducing mortality rates by an estimated 31%. Recent catastrophic failures highlight the crisis. In 2024, Johns Hopkins reported 67 deaths from post-surgical infections that resisted all available antibiotics. Walter Reed Medical Center recorded 203 cases of untreatable wound infections in combat veterans. Meanwhile, a pilot program at Edinburgh Royal Infirmary using medieval-inspired honey treatments achieved zero treatment failures across 156 trauma cases. Time is running out to rediscover this ancient knowledge before antibiotic resistance makes modern medicine obsolete. The World Health Organization warns we're entering a post-antibiotic apocalypse where common injuries become fatal. Again, exactly the conditions medieval surgeons routinely overcame. Climate change compounds the urgency. Rising global temperatures create ideal conditions for bacterial proliferation, while extreme weather events overwhelm medical infrastructure when infection risks are highest. Medieval protocols, designed for resource-limited environments and extreme conditions, offer solutions perfectly adapted to our deteriorating situation. Current research attempting to recreate medieval techniques shows promise, but lacks the systematic integration that made historical protocols so effective. We're missing critical elements: the precise material combinations, the coordinated treatment approaches, the social structures that supported consistent implementation. Medieval surgeons had solved problems we're desperately trying to solve today. We just need the humility to learn from them. Think about this the next time you worry about getting a tetanus shot after a minor cut or scrape. That anxiety about infection, whether you need antibiotics, whether the wound will heal properly, medieval knights didn't experience that fear. They possessed complete confidence in treatment methods that reliably saved lives using materials available in any medieval household. Have you ever wondered what would happen if modern antibiotics suddenly stopped working tomorrow? Medieval warriors knew they could survive devastating injuries using honey, wine, and carefully crafted tools. We've created a medical system so dependent on synthetic drugs that doctors panic when standard treatments fail. What experiences have you had with wounds that didn't respond to modern treatment? Share your thoughts in the comments. Have you ever tried traditional remedies that seemed more effective than expected? Do you think we've become too reliant on technology at the expense of time-tested natural methods? The broader lesson here is about human resilience and ingenuity under pressure. When medieval surgeons faced life or death challenges without modern resources, they developed elegant solutions through careful observation, systematic experimentation, and knowledge sharing across generations. Sometimes the oldest wisdom truly is the most valuable. In our next video, we'll explore how medieval castle builders solved structural engineering problems that modern architects are still trying to master. Another example of lost knowledge that could revolutionize contemporary construction. The past holds secrets that could save our future. We just need the wisdom to listen.